Hey everyone, welcome back to Zen Zone Health. I'm so glad you're here. Today we're diving into an important topic, colonoscopies and colon health. We're going to break down the basics from why it's important to what you can expect during the procedure. All right, let's get started.
So, what exactly is a colonoscopy? It's like a checkup for your colon, using a special instrument called a colonoscope. This camera allows us to see the inside of your colon on a screen, giving us a clear view of your colon walls. The main reason we perform colonoscopies is to look for colon cancer. This type of cancer often starts as small growths called polyps on the lining of the colon. If we find these polyps early on, we can often remove them before they develop into cancer. Colonoscopies also help identify other issues like diverticulitis and inflammatory bowel disease. Think of it like a dental checkup, but for your colon. It's a preventative measure that can help us catch problems early on when they're easier to treat. Early detection through colonoscopy plays a huge role in preventing colon cancer. By finding and removing polyps early, we can significantly reduce the risk of colon cancer developing.
Let's talk about why early detection is so crucial when it comes to colon cancer. Colon cancer is one of the most common types of cancer, but it is also one of the most preventable. In its early stages, colon cancer often doesn't cause any noticeable symptoms. This means that many people may not even realize they have it until it has progressed. By the time symptoms appear, the cancer may have already progressed, making it more difficult to treat. This is why regular screenings are so important. Colonoscopies allow us to detect precancerous polyps and early-stage cancers before they spread. These screenings can literally be life-saving. Think of it like a small crack in a bridge. If you catch it early, you can easily repair it. But if you let it go, it can become a major structural issue. Early detection is key to preventing a small problem from becoming a much larger one. It allows for more treatment options and a better prognosis. With early detection and treatment, the 5-year survival rate for colon cancer is significantly higher. This means more people can go on to live healthy, fulfilling lives. Some people might be hesitant to get a colonoscopy because they're worried about the procedure or the results. It's natural to feel anxious, but it's important to remember that the procedure is generally safe and quick. But the potential benefits far outweigh any temporary discomfort or anxiety. The peace of mind that comes with knowing your health status is invaluable. Knowing your risk factors and getting screened at the appropriate time can save your life. Risk factors can include age, family history, and lifestyle choices. Early detection gives you the best chance of successful treatment and a positive outcome. It empowers you to take control of your health. If you're due for a colonoscopy, don't put it off any longer. Procrastination can lead to missed opportunities for early intervention. Talk to your doctor about scheduling the procedure. They can provide you with all the information you need to feel comfortable and prepared. It could be one of the most important decisions you ever make for your health. Taking this step can ensure a healthier future for you and your loved ones.
When should you get your first colonoscopy? This is a crucial question for maintaining your health. For most people with average risk, the general recommendation is to start regular screenings at age 45. This age is chosen based on statistical data showing increased risk starting at this point. However, everyone's individual risk factors can vary significantly, and it's important to consider these variations. If you have certain risk factors, your doctor might recommend starting screenings earlier or getting them more frequently. These risk factors can be identified through a detailed medical history and lifestyle assessment. One of the most significant risk factors is family history. If you have a close relative who has been diagnosed with colon cancer, your risk increases substantially. If you have a close relative who has been diagnosed with colon cancer, your risk increases. This is because genetic factors can play a significant role in the development of colon cancer. Other risk factors include a personal history of polyps or inflammatory bowel disease. These conditions can predispose you to developing colon cancer. Lifestyle factors can also play a role, such as a diet high in red meat, smoking, and obesity. These habits can increase inflammation and other processes that contribute to cancer risk, and lack of physical activity. A sedentary lifestyle can further exacerbate these risks. Many of these risk factors are modifiable, meaning you can take steps to reduce your risk. Adopting a healthier lifestyle can make a significant difference. Have an open and honest conversation with your doctor about your family history and lifestyle. This dialogue is essential for creating a personalized screening plan. They can help you determine your individual risk level and recommend the appropriate screening schedule. This tailored approach ensures that you get the care you need when you need it. Early detection is key, and knowing your risk factors is the first step. By understanding and addressing these factors, you can take proactive steps to protect your health.
Let's talk about the colonoscopy procedure itself. Before the procedure, you'll be given sedation to help you relax and minimize any discomfort. You'll be lying on your side while the doctor gently inserts the colonoscope into your rectum. The colonoscope is a thin, flexible tube, so it navigates the curves of your colon with minimal discomfort. The camera allows the doctor to see the lining of your colon on a screen in real time. If any polyps are found, they can usually be removed right then and there using tiny instruments passed through the colonoscope. The entire colonoscopy usually takes about 30 to 60 minutes. Afterward, you'll be monitored in a recovery area for a short time while the sedation wears off. It's important to have someone drive you home from the procedure because the sedation can impair your reflexes and judgment. A colonoscopy is a relatively quick and painless procedure that can provide invaluable information about your colon health.
The prep for a colonoscopy is often the part people dread the most. It's understandable to feel anxious, but knowing what to expect can help ease some of that worry. The goal of the prep is to completely clear out your colon so the doctor has a clear view during the procedure. This is crucial for detecting any abnormalities or issues. This involves a combination of dietary changes and laxatives. Your doctor will provide specific instructions tailored to your needs. Typically, you'll start a clear liquid diet the day before your colonoscopy. This diet helps to ensure that your colon is free of any solid waste. This means no solid foods. It might be challenging, but it's a crucial step in the preparation process. You'll be sticking to things like clear broth, water, apple juice, black coffee or tea, and sports drinks. These liquids help keep you hydrated while ensuring your colon is clean. It's important to stay hydrated, so drink plenty of fluids. Dehydration can make the prep process more difficult and uncomfortable. In addition to the clear liquid diet, you'll also need to take laxatives as directed by your doctor. These medications help to empty your bowels completely. These laxatives come in different forms, such as pills or a powder that you mix with water. Follow the instructions carefully to ensure the best results. They work by stimulating your bowels and causing frequent bowel movements. This can be uncomfortable, but it's a necessary part of the process. A clean colon allows the doctor to see everything clearly and identify any potential problems. This visibility is key to a successful and thorough examination. To make the prep more bearable, try to stay home and near a bathroom. Keeping yourself occupied with books, TV, or other activities can help pass the time. Remember, the prep is temporary, and the benefits of a successful colonoscopy far outweigh any temporary discomfort. A clean colon can lead to early detection of issues, which is crucial for effective treatment and peace of mind.
What exactly can be found during a colonoscopy? The primary goal is to look for colon cancer. This involves identifying and removing precancerous growths called polyps. Most polyps are benign, but some can develop into cancer over time. During the colonoscopy, if the doctor finds any polyps, they can usually remove them right then and there. The polyps are then sent to a lab for analysis to determine if they're cancerous or not. Colonoscopies can also detect other issues besides polyps. For example, they can identify signs of inflammation, which could indicate conditions like Crohn's disease or ulcerative colitis. They can also detect diverticula, which are small pouches that can form in the colon wall. In some cases, a colonoscopy might also be performed to investigate symptoms like rectal bleeding or abdominal pain. The information gathered during a colonoscopy can help your doctor make an accurate diagnosis and recommend the appropriate treatment plan.
So, you've had your colonoscopy. Great! Now, what happens next? The follow-up and frequency of future colonoscopies depend on the findings of your procedure. If no polyps or other abnormalities were found, you likely won't need another colonoscopy for 10 years. If polyps were removed, your doctor will recommend a follow-up colonoscopy sooner, typically in 3 to 5 years. The size, number, and type of polyps removed can also influence the frequency of follow-up colonoscopies. If any polyps were found to be cancerous or precancerous, your doctor might recommend more frequent colonoscopies or other follow-up tests. Even if you've had a colonoscopy, it's still crucial to be aware of any changes in your bowel habits or any new symptoms. If you experience any rectal bleeding, abdominal pain, or changes in bowel habits, contact your doctor. Regular checkups and screenings are essential for staying on top of your health.
That's it for today's video on colonoscopies and colon health. Thanks for watching ZenZone Health. Don't forget to like, comment, and subscribe for more health tips and information. Stay healthy and take care. Hey everyone, it's my ebook from ZenZone Health, and welcome back to the channel. Today we're diving deep into a topic that's crucial for your overall well-being: colon health. We're going to explore 5 effective home remedies for natural colon cleansing, because let's face it, a healthy gut is a happy gut. Before we jump in, make sure you hit that subscribe button and turn on notifications so you don't miss out on any future health tips.
Alright, let's kick things off with the simplest yet most powerful remedy: water. Water is often overlooked, but it is the cornerstone of our health. It's not just about quenching your thirst, it's about maintaining the balance of bodily functions. You hear it all the time, but staying hydrated is truly the foundation of a healthy colon. Hydration helps in the digestion process, ensuring that nutrients are absorbed efficiently and waste is expelled properly. Without adequate water, our digestive system can become sluggish, leading to discomfort and health issues. Think of water as your body's internal cleansing agent. It works tirelessly to flush out toxins and impurities that accumulate over time. This cleansing process is vital for maintaining a healthy gut and overall well-being. It flushes out toxins, keeps things moving smoothly, and prevents that dreaded constipation. Constipation can lead to a host of other problems, including bloating, discomfort, and even more serious digestive issues. By keeping yourself hydrated, you ensure that your digestive tract remains in optimal condition. Aim for at least 8 to 10 glasses of water throughout the day. This might seem like a lot, but spreading it out over the course of the day makes it manageable. You can start your day with a glass of water to kickstart your metabolism and continue sipping throughout the day. And remember, sipping on water consistently is key. It's not just about the quantity, but also the frequency. Regular sips keep your body hydrated and functioning smoothly. Don't try to chug it all at once. Drinking too much water in one go can overwhelm your system and isn't as effective as consistent hydration. Now, if you're not a fan of plain water, try infusing it with some fresh fruits like lemon or cucumber for a little flavor boost. Infused water not only tastes better, but also adds a hint of vitamins and minerals, making your hydration routine more enjoyable and beneficial. You can get creative with your infusions. Try adding mint, berries, or even a splash of natural juice. The possibilities are endless, and it can make drinking water a delightful experience. So make water your best friend. It's a simple, cost-effective way to boost your health and keep your colon happy. Cheers to hydration and a healthier you.
Next up, we have a dynamic duo: lemon juice and honey. This powerful combination has been cherished for centuries for its numerous health benefits and refreshing taste. This combination is like a refreshing wake-up call for your digestive system. Imagine starting your day with a burst of citrusy goodness and the soothing sweetness of honey. It's not just a drink, it's an experience that revitalizes your body and mind. Lemon juice, packed with vitamin C, acts as a natural detoxifier, helping to flush out impurities. The high vitamin C content boosts your immune system, making you more resilient to common colds and infections. Additionally, the citric acid in lemon juice aids in breaking down food, making digestion smoother and more efficient. Honey, on the other hand, soothes the digestive tract and promotes healthy gut bacteria. It's a natural prebiotic, which means it feeds the good bacteria in your gut, helping them thrive. This can lead to better digestion, reduced bloating, and overall improved gut health. To harness their power, simply mix the juice of 1 lemon with warm water and a teaspoon of raw honey. Make sure the water is warm, not hot, to preserve the beneficial properties of the honey. Stir well until the honey is fully dissolved, creating a perfectly balanced drink. For optimal results, enjoy this zesty drink first thing in the morning on an empty stomach. This allows your body to absorb the nutrients more effectively, giving you a head start on your daily hydration and detoxification. It's a simple yet powerful ritual that can make a significant difference in your overall well-being. It's a great way to kickstart your digestion and set the tone for a healthy day. By incorporating this drink into your morning routine, you're not only supporting your digestive health, but also setting a positive intention for the day ahead. So take a moment to savor this zesty detox and feel the difference it makes in your energy levels and overall health.
Let's talk fiber, the unsung hero of digestive health. Fiber is like a superhero for your colon, adding bulk to your stool and keeping things moving along smoothly. Think of it as a gentle sweep for your intestines, preventing any unwanted buildup. So how do you get your daily dose of fiber? It's simple. Load up on fruits, vegetables, whole grains, nuts and seeds. These fiber-rich foods act like little scrubbers for your colon, promoting regularity and preventing constipation. Remember, a high-fiber diet is a happy gut's best friend.
Now let's move on to apple cider vinegar, a pantry staple with surprising colon cleansing benefits. This fermented wonder is known for its antimicrobial properties, helping to maintain a healthy balance of gut bacteria. Think of it as a natural disinfectant for your digestive system, keeping things in check. To incorporate apple cider vinegar into your routine, simply mix 1 to 2 tablespoons with warm water and drink it daily. You can also add a touch of honey to sweeten the deal. Just remember, a little goes a long way.
Last but not least, let's explore the soothing power of herbal teas. These natural beverages have been cherished for centuries across various cultures for their healing properties and delightful flavors. Whether you're looking to unwind after a long day or seeking a gentle way to support your digestive health, herbal teas offer a perfect solution. Certain herbal teas like ginger, peppermint, and dandelion have natural cleansing and digestive properties. These teas are not only delicious, but also packed with beneficial compounds that can aid in maintaining a healthy colon. Let's delve deeper into the unique benefits each of these teas offers. Ginger, known for its anti-inflammatory effects, can help calm the digestive system and reduce bloating. This spicy root has been used in traditional medicine to treat various gastrointestinal issues, from nausea to indigestion. By incorporating ginger tea into your daily routine, you can enjoy a soothing beverage that also supports your digestive health. Peppermint, on the other hand, can soothe indigestion and promote healthy bowel movements. The menthol in peppermint has a relaxing effect on the muscles of the digestive tract, which can help alleviate symptoms of irritable bowel syndrome and other digestive discomforts. Sipping on peppermint tea can be a refreshing way to keep your digestive system running smoothly. And then we have dandelion, a natural diuretic that can help flush out toxins. This humble weed is packed with vitamins and minerals, and its diuretic properties can aid in detoxifying the liver and kidneys. Drinking dandelion tea regularly can support your body's natural detoxification processes, contributing to overall colon health. To reap the benefits, simply enjoy a cup or two of these herbal teas throughout the day. Whether you prefer to start your morning with a warm cup of ginger tea, enjoy peppermint tea after meals, or wind down with dandelion tea in the evening, these beverages can easily fit into your daily routine. It's a relaxing and flavorful way to support your colon health. So next time you reach for a beverage, consider choosing one of these herbal teas. Not only will you be treating yourself to a delicious drink, but you'll also be taking a step towards better digestive health. Sip your way to a clean colon and enjoy the journey of wellness with every cup.
That's it for today's video on natural colon cleansing remedies. We hope you found these tips helpful and easy to incorporate into your daily routine. Remember, a healthy gut is the foundation of overall well-being. If you enjoyed this video, please give it a thumbs up and share it with your friends and family. And don't forget to subscribe to ZenZone Health for more health tips and tricks. Until next time, stay healthy and keep those guts happy.
Welcome to our channel. Today, we're diving into 14 effective ways to keep your colon healthy. It's not just about regularity, it's about your overall well-being. We're talking about boosting your energy levels, strengthening your immune system, and even improving your mood. Stick around and let's get that colon squeaky clean.
Staying hydrated is crucial for a healthy colon. Drinking plenty of fluids, especially water, helps soften stool and makes it easier to pass, preventing constipation and promoting regularity. Aim for at least 8 glasses a day and consider adding some herbal teas or infused water for an extra flavor boost.
Apple cider vinegar, or ACV, is a gut health superstar. It's packed with probiotics, those good bacteria that keep your digestive system running smoothly. Try adding a tablespoon or two to a glass of warm water in the morning, but start slow and see how your body reacts. Flax seeds are like little powerhouses of fiber, both soluble and insoluble. They act like a scrub brush, gently sweeping away waste and toxins. Sprinkle some on your yogurt, add them to your smoothies, or mix them into your oatmeal for a fiber boost.
A colon flush, or colonic irrigation, involves flushing out the colon with water or herbal solutions. Talk to your doctor before trying a colon cleanse, as it's not suitable for everyone and should be done under professional supervision. Omega-3 SS have powerful anti-inflammatory properties that can help calm and soothe the digestive tract, reducing symptoms of IBS and other inflammatory bowel conditions.
Garcinia cambogia is a tropical fruit that's gained popularity for its potential weight loss benefits. It can also help keep things moving in your digestive system by increasing bowel movements. However, it's essential to talk to your doctor before adding it to your routine.
Sea salt, in moderation, can act as a natural laxative. It works by drawing water into the colon, softening stool, and making it easier to pass. We're talking about unrefined sea salt, like Himalayan pink salt, which contains trace minerals beneficial for your health. Try adding a teaspoon to a glass of warm water in the morning, but start slow and see how your body reacts. Fermented foods are teeming with probiotics, those beneficial bacteria essential for a healthy gut. Foods like yogurt, kefir, sauerkraut, and kimchi help restore the balance of good and bad bacteria in your gut, improving digestion and boosting your immune system.
Fiber is like the magic ingredient for a healthy colon. It adds bulk to your stool, making it easier to pass and preventing constipation. Make sure you're getting plenty of fiber from fruits, vegetables, whole grains, and legumes. Fennel tea has been used for centuries to aid digestion and relieve bloating. It contains compounds that can help relax the muscles in your digestive tract, reducing gas and cramping. Try sipping on a cup after meals to aid digestion and promote regularity.
A liquid fast can be an effective way to give your digestive system a break and allow it to reset. It's essential to talk to your doctor before doing a liquid fast, especially if you have any underlying health conditions. Lemon juice is a natural detoxifier that can help cleanse your colon. It's rich in vitamin C and citric acid, which can help stimulate digestion. Try adding the juice of half a lemon to a glass of warm water in the morning or before meals to promote regularity. A colonoscopy is a medical procedure that allows your doctor to examine the lining of your colon for any abnormalities. It's the gold standard for colon cancer screening and can also help diagnose other digestive issues. It's generally recommended to start getting colonoscopies at age 50 or earlier if you have certain risk factors. Ginger has long been used to soothe digestive ailments. It contains compounds that can help reduce nausea, bloating, and gas. You can enjoy ginger in many ways. Add it to smoothies, stir-fries, or teas, or simply chew on a small piece of fresh ginger for quick relief. So there you have it, 14 ways to keep your colon healthy and happy. Incorporate these tips into your daily routine, and you'll be on your way to a healthier, happier you. Thanks for watching. Don't forget to like, comment, and subscribe for more health tips. Stay healthy and take care of your colon.
Welcome to Zen Zone Health. Today, we're diving deep into a topic that's close to my heart: the early signs and symptoms of colon cancer. You see, folks, knowledge is power. And when it comes to our health, being informed can make all the difference. Early detection is the absolute key to improving survival rates for colon cancer. So, let's equip ourselves with the knowledge to spot these warning signs early on. Let's dive in. Now let's talk about something that can be a bit uncomfortable to discuss, but trust me, it's crucial. It's a topic that many people shy away from, but it's one that could potentially save your life. Rectal bleeding is one of the most common early signs of colon cancer. It's a symptom that can easily be overlooked or misinterpreted, but it's important to pay attention to it. This bleeding isn't always a gushing, dramatic thing. In fact, it can be so subtle that you might not even notice it at first. It can be subtle, just a little bit of bright red blood on the toilet paper or in the toilet bowl. This kind of bleeding is often mistaken for something less serious, like hemorrhoids. Sometimes it might be darker, almost maroon in color, mixed in with your stool. This darker blood can be a sign that the bleeding is coming from higher up in the colon.
Now, look, I know it's easy to brush this off as hemorrhoids, but please, don't. Hemorrhoids are common, but they aren't the only cause of rectal bleeding. Any sign of rectal bleeding needs to be checked out by a doctor. It's not something you should ignore or try to diagnose on your own. It's always better to be safe than sorry, right? A simple checkup can provide peace of mind and, if necessary, catch something early when it's most treatable. Early detection is everything when it comes to colon cancer. The earlier it's caught, the better the chances of successful treatment. So, don't hesitate. If you notice any signs of rectal bleeding, make an appointment with your doctor right away. Your health is worth it.
We're going to get up close and personal with our bowel movements for a moment. I know, not the most glamorous topic, but stick with me. Have you noticed a change in the shape of your stool lately? Specifically, has it become consistently narrower than usual, like a pencil-thin appearance? This, my friends, can be a red flag. A tumor in the colon can actually narrow the passageway, making it difficult for stool to pass through. Now, I'm not saying every change in stool shape is a sign of cancer. But if you notice a persistent change, especially if it's accompanied by other symptoms we're discussing, please don't ignore it. Make an appointment with your doctor and get checked out. Let's talk about a feeling we've all experienced at some point. That urgent need to go to the bathroom. But when you get there, nothing happens. Frustrating, right? You rush in, expecting relief, but instead, you're left sitting there, puzzled and uncomfortable. It's a common scenario that can leave you feeling quite uneasy. Now, if this happens occasionally, it's usually not a big deal. Most of us have had those moments where our body just doesn't cooperate. Maybe it's stress, maybe it's something you ate, or maybe it's just one of those days. You shrug it off and life goes on. But if you're experiencing this frequently along with a feeling of incomplete evacuation, it's time to pay attention. Imagine having to visit the bathroom multiple times a day, each time feeling like you haven't fully emptied your bowels. It can be quite distressing and can significantly impact your daily life. This is called tenesmus, and it can be a sign of something more serious like colon cancer. Tenesmus is that persistent feeling that you need to have a bowel movement, even if you've just gone. It's not just an inconvenience, it's a symptom that shouldn't be ignored.
Imagine a tumor in your colon, partially blocking the passage. This blockage can make it difficult for stool to pass through, leading to that constant urge to go. It's like a roadblock in your digestive system. It's like trying to squeeze a large object through a small opening. The pressure builds up, but nothing can move through easily. This can cause discomfort, pain, and that frustrating feeling of incomplete evacuation. So, if you're feeling that constant urge to go, but nothing's happening, or you feel like you can't fully empty your bowels, please don't ignore it. These symptoms are your body's way of telling you that something might be wrong. Get it checked out by a medical professional. Early detection is key in managing and treating conditions like colon cancer. Don't let embarrassment or fear stop you from seeking help. Your health is too important to ignore.
Okay, let's talk about constipation. We've all been there, right? It's uncomfortable, it's annoying, but it's usually not a major medical concern. However, if you're experiencing persistent constipation that just won't budge, even with dietary changes and over-the-counter remedies, it's time to dig a little deeper.
You see, a tumour in the colon can actually obstruct the passage of stool leading to constipation. So, if you're dealing with constipation that's out of the ordinary for you and it's been going on for a while, don't just suffer in silence. Talk to your doctor. They can help determine the underlying cause and get you back on track.
Our stomachs, they talk to us, right? And sometimes they're trying to tell us something important. Frequent abdominal pain, especially if it's a cramping type of pain, is something you should never ignore.
Now, I'm not talking about the occasional tummy ache after a spicy meal. I'm talking about persistent pain, especially if it's accompanied by other symptoms like bloating, nausea, vomiting, or changes in your bowel habits. This type of pain can be a sign that something's not right in your colon.
A tumor can cause blockages, leading to these uncomfortable symptoms. So, if you're experiencing persistent abdominal pain, don't just pop a painkiller and hope for the best. Get it checked out by a medical professional. Unexpected weight loss. When dropping pounds isn't a good thing, we all love it when our clothes fit a little looser, right? But sudden, unexplained weight loss is never a good thing.
If you're noticing the pounds dropping without any effort on your part, especially if it's accompanied by other symptoms like changes in bowel habits, abdominal pain, or fatigue, it's time to see your doctor.
Colon cancer can sometimes cause weight loss because the tumor affects your body's ability to absorb nutrients properly. So, while weight loss might seem like a positive thing on the surface, it's crucial to pay attention to your body and seek medical advice if something feels off. Chronic fatigue. Beyond just being tired. We live in a fast-paced world, and it's easy to feel tired, right? The hustle and bustle of daily life can wear anyone down. From long work hours to endless commutes, it's no wonder we often feel drained. But there's a difference between everyday fatigue and chronic fatigue that just doesn't quit. Everyday fatigue can usually be remedied with a good night's sleep or a relaxing weekend. However, chronic fatigue is a different beast altogether.
If you're constantly feeling exhausted, even after a good night's sleep, and you find it hard to get out of bed in the morning, it might be more than just being tired. And this fatigue is lingering for weeks or even months. It's not something to ignore. Chronic fatigue can creep up on you, making each day feel like a struggle. It's time to listen to your body. Pay attention to the signals it's sending you. Persistent fatigue is your body's way of telling you that something might be wrong.
Chronic fatigue can be a sign of many things, including serious conditions like colon cancer. It's not just about feeling tired, it's about understanding the underlying causes. Sometimes blood loss from the tumor can lead to anemia, which can make you feel constantly drained. Anemia reduces the number of red blood cells, which are crucial for carrying oxygen throughout your body.
So, if you're experiencing persistent fatigue that's impacting your daily life, don't just brush it off as stress or overwork. Chronic fatigue can affect your ability to perform daily tasks, enjoy activities, and even impact your mental health. Talk to your doctor and get to the bottom of it. Early detection and treatment can make a significant difference. Your health is too important to ignore. Take action and seek medical advice to ensure you're not overlooking a serious condition.
Nausea and vomiting, more than just an upset stomach? We've all experienced nausea and vomiting at some point, usually due to a stomach bug or something we ate. But what if these symptoms persist and you can't seem to shake them? Persistent nausea, especially when accompanied by vomiting, can be a sign of something more serious, including colon cancer. A tumor in the colon can sometimes obstruct the digestive tract, leading to these uncomfortable symptoms. So, if you're experiencing frequent nausea and vomiting that's unusual for you, don't just reach for the antacids. Make an appointment with your doctor to rule out any underlying medical conditions. Stay aware, stay healthy. Thank you for joining me today on Zen Zone Health. Remember, early detection is our greatest weapon in the fight against colon cancer. Pay attention to your body, be aware of these signs, and don't hesitate to reach out to your healthcare provider if something feels off. Keep track of any changes in your bowel habits, stool shape, weight, and overall health. And remember, knowledge is power. Don't forget to like, share and subscribe to our channel for more health tips and information. Stay healthy and stay informed.